This is page 7 of your embryology booklet, and it's called Watching the Growing Embryo. You can use the light from an overhead projector or other candling device to observe a growing embryo. This is called candling. As you do this, try to find the parts and see what is discussed below. The embryo will always float to the top of the yolk, so do not turn the egg before candling. When your teacher candles the eggs, record your observations on page 13. You will observe the following when you candle at these days. On day 3, you will see the question mark shaped embryo, heart beating, and blood vessels. On day 4, you can see the eye, which is a black spot. Day 6, you will see the embryo move on its own for the first time, and all parts are there. The blood vessels will keep getting larger to help the embryo get the needed nutrients. The air cell will increase in size, it'll get bigger, and as the embryo grows and fills the egg, it makes the egg darker and harder to view. Days 19 and 20, the embryos will pip into the air cell. You can observe them moving in the air cell. On days 20 and 21, you can observe them hatching. Daily growth of the embryo. What else is happening in the egg that you cannot see? Day 1. The germinal spot grows and cells begin to split into specific types of cells. Day 2. Blood vessels show on the yolk. Start of yolk sac. Day 3. Candle. This day, there's a question mark shaped embryo visible. Blood vessels on the yolk sac are defined. You can see the heart beating. Amnion is complete. Brain and head are visible. Day 4, candle this day. Eye looks like a black spot, becomes visible, organs formed. Day 5, reproductive organs form. The sex of the embryo is known, whether it's a male or a female, so whether it's a hen or a rooster. Day 6, candle this day. All parts are present. Amnion evident. It's a clear fluid sac for exercise and protection. Chick rocks and rolls for the first time. There's some voluntary movement. So over here they've actually labeled some of those parts that we just spoke about. So you can see where the amnion is. It's kind of a layer of fluid that helps cushion and protect that developing embryo. We're going to turn and continue on here with page 8. Days 7 to 9, you can candle again on day 9. Abdomen becomes more defined, that would be the stomach area. Feathers, down, start to form. Mouth appears to open and close. Embryo begins to look like a chick. There's the picture again of days 7 through 9 on the top. Days 10 to 12, bones and beak begin to harden. Skin pores visible. Eyelids cover the eye, and down feathers become visible. There's your picture there, days 10 through 12. Days 13 through 17, candle on day 15. Scales, claws, and feathers complete. Small intestines are taken into the body. The albumin or the egg white is nearly gone, and the embryo turns to the blunt end of the egg. You can see that air cell growing. Days 18 to 19, candle on day 19 or 20. The growth is complete, preparing to hatch. The shell is full except the air cell. We stop turning the eggs after 18 days. On day 20, the embryo breaks into the air cell, takes first breath, and becomes a chick. The yolk sac is completely drawn into the body cavity or the abdomen. Day 21, the chick hatches. The egg tooth is visible after hatch. Look at egg tooth at the tip of the beak now because it will fall off within 2 days of the hatch. So that's pretty neat. I think we talked briefly about this before. The young chick will pull that yolk right into its abdomen. You can't see it anymore when we get down to day 21. That will provide nutrition for that chick the first few days of life. And the little egg tooth that's labeled here, I'm not sure how well you can see it on the beak. It's this little part on the beak. This is the head, and it's kind of tucked under its wing. That egg tooth is what helps it break through the shell. And then again, after 2 days of hatching, that little egg tooth falls off.